Good morning, everyone. Thanks for joining us this morning. While vaccine updates probably aren't as riveting as Oprah's interview with Prince Harry and Meghan Markle, we'll certainly give it our best this morning. So it's time to put those sweatpants away and bust out the real pants because we're headed back to the office. Again, vaccine time is here. Just a little less than a year ago, we hosted our first COVID-related webinar, and blink, here we are. HR and employment law is intimidating as it is. Add in learning about a virus none of us knew anything about before a year ago. We're grateful for the opportunity this morning to serve you information as it comes and continuing this morning's webinar as well. So with that, I'd like to introduce our guest this morning, Amy Gibson. I almost said Amy Gibson. Amy Gibson from Ehrenberg Goldgen. Good morning, Amy. Tell us a little bit about yourself.
Good morning. Thank you, Jenny, and thank you, Empower HR, for inviting me to this discussion. As Jenny mentioned, my name is Amy Gibson, and I am a partner at Ehrenberg Goldgen in Chicago. We are a mid-sized general practice law firm with about 50 attorneys. I am the co-chair of our firm's employment practice group, and in that capacity, I help small to mid-sized businesses navigate through complex employment laws. I help them create and implement policies for their workforce, and I also represent them in litigation. I'm looking forward to this discussion today.
Awesome. Thanks so much, Amy, for providing the legislative help today. And I'd also like to introduce Jennifer Johann, our VP of HR Consulting at Empower HR. Good morning, Jennifer. Tell us a little bit about you. For those who don't know you as Jadro, tell us a little bit about yourself.
Awesome. Good morning, everybody. As Jenny said, I'm Jennifer Johann. I lead the HR consulting practice here at Empower. So not only do I have the honor and privilege of serving our internal teams, I also get to serve our clients. So my HR experience is in a variety of different industries, including retail, managed services, consumer goods, and manufacturing. And I've been practicing HR for a really long time. I'm excited to be here today and to be talking about this really important topic with everybody.
Awesome. Thanks so much. So a couple quick things to note. We did get some of your questions in advance. A lot of what many of you have asked is already built into the content for today. So we will try our very best to get to everyone's questions. Also, I'd like to call out in the handout section, there are 2 handouts. There's contact information for all of us if you decide you need further information following the webinar this morning, as well as a vaccine blog written by one of our HR business partners, Jessica Young. So with that, we've got our vaccine ready and our salam pass patches. I hear that people's arms get sore following the vaccine. Let's take it away. Amy, the biggest question that we are getting from our audience, and I'm sure you're getting this from many of your clients as well, is can employers require employees to get the vaccine?
Generally speaking, yes, unless an employee is not able to get the vaccine because they have a disability or they have a sincerely held religious belief that would either preclude them from getting the vaccine or, because of their religious belief, they would not want to get the vaccine. And in those situations, an employer would have to provide an exception to their mandatory vaccination policy under those circumstances.
Got it. So it sounds like should they, but it sounds like you're saying it depends, right? So what are some other things to consider when you're an employer making decisions around whether or not to mandate the vaccine?
It's a great question. And as I'm sure you can imagine, the answer is a little bit complex, but I'll walk you through 8 different things to consider when determining whether or not to mandate the vaccine in your workplace. So number 1, as a practical matter, many of us can't get the vaccine right now, unless you're in a specific group of individuals who are eligible for the vaccine. And of course, you have unlimited time to call every Walgreens within a 100-mile radius of your home in order to try to schedule an appointment, which none of us have time to do. Yes, guilty. If you're laughing, you understand. And I'm sorry. You might not want to consider having a mandatory vaccination policy for that reason, at least until it's widely available, which supposedly is going to happen at the end of May, but that's TBD. Number 2, whether or not you want to mandate the vaccine is probably going to depend on the type of employer you are. So for example, if you're in healthcare, childcare, senior care, if you're in the restaurant or hospitality business, those types of employers might want to consider mandating the vaccine just because of their clientele and the nature of their business. On the other hand, most traditional office type settings are not going to require vaccines, but again, it's not a hard and fast rule, and it really depends on the type of business.
Makes a lot of sense.
Number three, number three, if you're going to have this policy, are you prepared to actually enforce it and discipline or terminate employees who won't comply? So for example, what if your top salesperson just refuses to get the vaccine, irrespective of whether they have a disability or a sincerely held religious belief? They're just not comfortable getting it. They don't want to get it, but you have a mandatory vaccination policy. Are you going to fire your top person? Something you need to consider, because if you're not ready to take those actions, why bother having a mandatory vaccination policy?
Absolutely.
Number 4 on the list is, are you ready to make accommodations for those who can't get the vaccine? So let's say you have an employee who can't get the vaccine because she's disabled, and you think that she poses a direct threat to your workforce, which is a totally separate analysis I'm not going to get into, but we'll assume that you believe this person poses a direct threat because they're not getting the vaccine. You'll need to have a discussion about whether there's an accommodation you can provide to her that would allow her to continue to work in your workplace while at the same time keeping everyone else safe. So in that situation, you might offer her the ability to work from home, which a lot of employers are doing. You might move her desk, move her workstation so that she's kept sort of separate and apart from the remainder of the workforce. You might change her hours. These are all different things you might consider to allow this person to remain in your workplace. Of course, this is a case-by-case assessment. Nothing is black and white in the COVID world. So I would encourage you, if you have this situation come up in your workplace, to contact your Empower HR representative or the attorney that you work with. 5th on my list is, are you prepared to pay employees to get the vaccine? Yes, you heard me right. The FLSA requires employers to pay employees for the time it takes to get the vaccine. And the Illinois Department of Labor just this week came down with guidance that basically echoes what's in the FLSA, that employers are required to pay an employee to get the vaccine even during off work hours. So even if an employee goes early in the morning before work or on a weekend, if you have a mandatory vaccination policy, you're going to have to pay for their time. And if they're getting 2 doses, that would be double the cost. So again, something to keep in mind.
And Amy, I would assume that would, not just from a cost perspective, that would be administratively difficult as well, right? So if you only have time clocks or something to that effect, how are you capturing that time? So there's the hard cost in paying those employees, but the soft cost on your team on how to capture that time as well.
Exactly. Yeah. So a cost burden and also an administrative burden as well. That's a good point.
Sure.
6th on my list of considerations is what happens if an employee gets sick from taking the vaccine? This, again, we're in uncharted territory, so we don't really know the full scope of an employer's liability under those circumstances, but there's a possibility that the employee could file a workers' comp claim, and then you would have to deal with that complaint as well. We obviously don't have much information on that point because the vaccine is just being rolled out, and that issue really isn't ripe for determination, but I would encourage you to stay up to date on your state workers' comp laws and track those cases if you have the capability. The 7th point I think I would encourage everyone to consider is whether mandating the vaccine is going to take a hit on employee morale. Generally speaking, people don't really like to be told what to do. I mean, it's hard enough getting employees to actually do their jobs. And now you're forcing them to have something injected into their body. You know, I think it's kind of a tough sell. And lastly, legislators in many states, including Illinois and Indiana, they are discussing legislation right now to bar mandatory vaccination plans or to make it illegal for an employer to take adverse action against employees who won't get the vaccine. We don't know at this point whether or not these bills are actually going to become law, but it's definitely something to keep in the back of your mind and to stay up to date on to ensure that you don't implement a mandatory vaccination policy in a state that has passed a law barring those types of plans. And the one final note I'll add on this topic is, for what it's worth, I don't have a single client that's considering a mandatory vaccination plan at this time. Jenny and Jennifer, I don't know if your Empower clients are considering mandatory vaccination plans.
Yeah, no, you know what? We're in the same situation. We don't have clients that are considering it at this time either.
Amy, thank you so much. That was such a great legislative overview. And honestly, for those of you listening, this legislation, as you know, from the beginning of COVID, changes literally by the week. So we will continue to keep you informed and abreast of any new developments as we continue to see this and watch this evolve over time. So watch out for compliance alerts from Empower HR and your HR business partners. And of course, partnering with Amy and a firm like hers will also keep you up to the latest and greatest. Shifting gears a little bit from legislative compliance overall, Jadro, encouraging employees, how there's a human side to how we treat this, right? And Amy made a great point, is how is this going to take a hit on morale? People don't like to be told to do things, right? Some people might be more holistic in nature and take more vitamins and supplements and don't believe in the vaccine. So tell us a little bit about your thoughts on the human aspect and encouraging employees to become vaccinated.
Yeah, no, that's a great question, Jen, and it's an important one, so I'm really glad that you asked that. I think we do have to think about the human element as we're having these discussions and making these decisions about the vaccine. People have been through a lot this past year, right? I mean, and they still continue to struggle with things, from mental health issues to trying to juggle working at home and homeschooling their kids and taking care of sick family members. So while this vaccine to some people is their golden ticket to kind of getting back to normal, for other people, it's a really hard decision that they're wrestling with, and they're not exactly sure what that right decision for them is. So I do think that as leaders, as employers, we do need to continue to be flexible with employees. Flexible, the buzzword from last year, right? You have to be flexible. But I do think we should continue to be flexible. We should make sure that employees are feeling supported and safe as they're trying to, make these hard decisions, and then also making sure that we're just being really open and transparent in our communications.
Yeah, that's great advice, Jadro. Thanks so much. What about, can you offer benefits or incentives to employees for getting vaccinated?
You can, definitely. And I think a lot of employers are trying to opt for a little less forceful way to encourage employees to get the vaccination, and just ways that might feel a little bit more employee friendly. And an incentive can do just that, right? So, there's a couple different things for employers to consider. There's either offering paid or unpaid time off so that employees can actually have extra time away from work to go get the vaccine. Some employers are offering unpaid time to do this. Obviously, if you can pay it, it's more of an incentive, but I know that not every employer is in a position to do this. I would recommend, by the way, if employers are looking to provide a paid time off incentive, that they would update their paid time off policy to reflect that. Another form of incentive to consider would be some type of a benefit or offering like a small bonus even a gift card to employees who get vaccinated. And this is an acceptable way to incentivize employees. I would just say a couple things on that. One, you want to make sure that if you're going to do an incentive, that you keep in mind that there could be tax implications. So you just want to account for that when you're determining the amount of the incentive. And then the other thing would be that if you do offer an incentive, you should consider, or you actually need to consider, alternatives to those employees who are not able to get the vaccine. So Amy mentioned earlier in her response that people, if they have a disability or maybe certain religious beliefs or they're pregnant, those groups of people who are not able to get the vaccine, you want to have an alternative so that they also have access to that incentive as well. So I do feel that offering some sort of incentive is a really small price to pay to potentially mitigate any future cost that an employee, or a cost to an employer, if an employee would need to take time off for an extended period of time due to being sick, or, you know, even worse, if they're trying to work at home while they're sick and they're not very productive.
That's great guidance, Jadro. Any other things to consider as an employer when you are taking this sort of policy change or mandate into consideration? What else should people be thinking about?
You know, I think outside of mandates and incentives, there are a couple other things that employers could do to encourage employees to get the vaccination. One of those things would be, you know, I think there's a lot of unknowns and it does scare some people. So I think if employers can actually share accurate information with their employees about the vaccine, that could be really helpful. And that would be super easy to communicate, right? They could do it in meetings or town halls or newsletters and even postings throughout the facility. I think just putting information in employees' hands so that they can make good decisions could be helpful. The other thing to consider would be sharing a list of providers or even locations and times where employees can go get the vaccination locally. I've heard horror stories about, where do I go? How do I register? So I think just making that a little bit more convenient for people by giving them that information could be helpful. I know for me, I'm definitely more apt to go do something when it's more convenient. So those are just a couple of additional things I think employers could consider.
Super helpful. What do you think about showing leadership? We have a client, I won't name them, but their leader sent out an email specifically saying, hey, I'm getting the vaccine. While I'm not mandating it, I would encourage you to do the same. So what do you think about leadership sort of setting the standard as it relates to this specifically?
Yeah, I think that can be helpful. I do agree with that approach. I mean, people seeing other leaders that they respect and who have credibility within their organization making those decisions, and even as a leader making yourself available to employees to answer questions about it and letting them know what the experience was like for you, I think could be helpful too.
Great. What about employers, the need to have a vaccine policy specifically? A documented policy that's potentially in the handbook or what have you?
Yeah, you know what? It's not absolutely necessary, but it's definitely recommended. If you're going to have a mandatory policy or an incentive-based policy, I would recommend, documenting that just so employees know what to expect. So for example, if you're going to mandate the vaccine, giving employees information about the timing in which they have to do that and letting them know that they're going to have to show proof of it and things of that nature, I think is really important.
Awesome. Anything else, Jennifer, from an employee sort of impact perspective that we missed?
Not that I can think of, no.
Awesome. Well, there's the pre-vaccination, right? Whether to mandate or not mandate, whether to have a policy, have an incentive plan, what have you. What about post-vaccination issues? What happens when somebody gets sick? What happens if somebody has a different adverse reaction, not just getting sick and feeling flu-like symptoms, but what if they have, I've seen some stories about anaphylactic reactions to the vaccine. So Amy, I'm going to turn back to you now. Can you ask an employee for proof of vaccination?
So according to the EEOC, yes, but, and there's always a but, because nothing is ever clear and black and white in the law. There are some states, including, well, that's why I have a job. I digress. There are some states, including Illinois, that are considering legislation that, if enacted, would prohibit an employer from requiring an employee to prove they got the vaccine. So sit tight on this issue. There's conflicting guidance. But again, I would encourage you to stay up to date on your state and local laws before you implement a policy that does require proof of vaccination.
Great, great. Jennifer, should vaccinated employees, just based on all of the new guidelines from the CDC and et cetera, should vaccinated employees still be required to wear masks and still adhere to social distancing rules and just follow the normal course of business?
Yeah, good question, Jen. And you know, yes, the recommendation is that employees should still continue to be required to wear masks and social distance when they're at work. In fact, the CDC does recommend that fully vaccinated people continue to take those COVID precautions when they're out in public. And I'll say too, you know, with such a small percentage of the population who've actually been able to get the vaccination, and with so many employers not mandating the vaccine at this time, I do think it's best to follow these safety precautions. I do want to say though, or actually point out that just this week, so this is hot off the press, the CDC did issue its first set of recommendations for vaccinated people in terms of those activities that they can start doing again. So those, just to kind of high level go through those things, the recommendations say that if a vaccinated person can actually visit with other fully vaccinated people without wearing masks and without social distancing. Okay. And when they're visiting with unvaccinated people indoors, as long as it's within small groups, they can do that without a mask and without social distancing, as long as there's nobody in that small group who is at risk for a serious health condition. And then the third part of that new guidance is that they can also refrain from any type of quarantining or having to go get tested if they've been exposed to someone with COVID, providing they don't have any symptoms.
Awesome, thank you. Amy, Ffcra was a big one that just a little bit less than a year ago, we had a ton of interpretation and reading to have to do, both on the legal side and the HR side. So there are a lot of things as it pertains to, a lot of questions as it pertains to the vaccine specifically, that people are asking questions about as it pertains to Ffcra. So is an employee entitled to paid leave under the Ffcra to get vaccinated?
It's a great question. And I think we all have post-traumatic stress syndrome from having to deal with the Ffcra last year, and most of us are probably glad that we've put it behind us, because at this point it is optional for employers to allow paid leave under the Ffcra. So the answer to the question is, if you are allowing leave under the Ffcra, you do not have to provide paid leave for an employee to get the vaccine. But that's not to say that you wouldn't necessarily allow an employee to use PTO, depending on your PTO policy, or if an employee doesn't have PTO, to pay them for time off or to otherwise provide unpaid time off so that they can go and get the vaccine.
Great. Jadra, I have a scenario for you. Let's say one of our vaccinated employees has come into contact with someone who tested positive for COVID-19. Do they need to quarantine?
Yeah, I'm going to lean on what the CDC says about that. And according to them, they would not need to quarantine provided that they are fully vaccinated and that at least 2 weeks has passed since they had that final dose of the vaccine. Also, the other thing that would have to be in place is that the exposure would have had to have happened no more than 3 months from receiving that last dose of the vaccine. And then, of course, providing they haven't had any symptoms since the exposure.
Amy, on the legislative side of that, or the legal side, I should say, what if the employee doesn't satisfy each of those criteria specifically? What next?
Yeah, so the CDC really hasn't made our lives easy with this one, as they really haven't over the last year or so. If the vaccinated employee has to quarantine, they don't satisfy the criteria for avoiding quarantine, and they don't have symptoms, the CDC recommends that the employee quarantine for 14 days, but the CDC also approves a shorter quarantine period of 10 days after exposure or 7 days after receiving a negative COVID test that was taken no earlier than 5 days after the exposure. So that's the rule, or that's the guidance if the employee does not have symptoms. If, on the other hand, the employee does exhibit symptoms, the CDC recommends that the employee quarantine until it's been at least 10 days since the symptoms first appeared, and 24 hours with no fever, and their other symptoms have improved, whatever that means. We don't know what improving means. It's very subjective. Don't try to memorize these CDC guidance. The CDC changes its guidance on a regular basis. You know, not to any fault of the CDC, but we are living in a very fluid situation with a virus that we're learning about every single day. So before making a decision about whether or not an employee, vaccinated or otherwise, can return to the workplace, take a look at the CDC's website, at their guidance, or of course, reach out to your Empower HR representative or the attorney you work with if you have questions, because it's definitely complicated and can be very confusing.
Yeah, and I would anticipate that. Well, go ahead, Jadril, sorry.
Oh, no, I was just going to ask Amy, you know, one of the things that we do for our clients is we help them with their COVID response plans, which has in there, you know, a lot of these guidelines for the amount of time that people have to quarantine, things of that nature. Are you seeing that most of your clients are updating those plans with this shorter quarantine time frame, you know, going from the 14 to the 10 days? Or are employers, you know, tending to stay more on the conservative side, just, you know, to take precaution and keeping it at 14? What are you seeing?
I'm seeing a little bit of both. As far as updating the plans go, a lot of my clients have included more general quarantine requirements in their plans, and then they refer to the applicable guidance at the time of making a decision. You know, my clients, generally speaking, they want their employees to be at work. They want their workforce to be up and running as it was a year ago. So I think to the extent, you know, that they want to get back to normal, they are, at least from my experience, more willing to take the CDC's sort of more aggressive guidance, for lack of a better word, and not requiring their employees to remain out of work for 14 plus days. But again, you know, the guidance is exactly that. It's guidance, and there are different levels of guidance, and there are different comfort levels for employers. So it's out there as a resource for employers to make a decision based on that information that suits their needs.
Thanks. Awesome.
Well, we're going to take a quick breather here and shift over to, we're getting some questions from the audience that are starting to roll in. And we also have some questions for those of you who registered and sent some pre-webinar questions in that we'd like to get to. Before we do that, Jadril, I think that the bigger question that we're getting multiple times here is, can you explain to us the beautiful drawing of the plant behind your head?
Oh my goodness. So you guys, when we got on this morning just to prepare for the webinar, I noticed that both Amy and Jen had plants behind them. So I am not a creative person, so I tried to draw one on the whiteboard behind me, which you can see, and I didn't, because I'm not a good artist, I was going to erase it because it looks terrible, obviously, but I realized that I actually used a Sharpie on our whiteboard, so I can't even erase it.
So the moral of the story is, don't write your COVID guidance in Sharpie because it is changing by the day. Switching gears over to some of our audience questions. We had a question come in. Please provide specific examples of large companies that are requiring testing of either employees or customers. And when we talked about this as a group, I think it's more geared towards industry. Jadra, would you agree? What are some larger industries that you're seeing that are requiring?
Yeah, and Jen, just real quick, as we mentioned earlier, right, as of today, none of the clients in either of our firms are actually mandating that employees be vaccinated. I do think that we may see a change in that as the vaccine becomes more readily available. But those industries where there's a recommendation that you consider making it mandatory would be healthcare, education, food manufacturing, childcare, senior care, restaurant, hospitality groups. Those are the main ones that we're seeing where there's a recommendation to mandate.
We had a question come in subsequent to that that says, we are a child care center who is required by the state to mandate that employees have certain vaccines for employment. Why would the COVID vaccine be any different when it comes to paying people or dealing with reactions? Amy, you suggested keeping a close eye on state by state guidance. I would assume that at some point, and Jadra, when you were talking about specifically the industries that may consider mandating, I would assume daycare and childcare is obviously one of those, aside from just education in general. But Amy, do you agree that abiding by the state's guidelines as they come in this circumstance as it pertains to policy for childcare?
Generally speaking, you know, if you follow the state's guidelines and restrictions, you're probably going to be in the clear. You know, they're either going to be mandates or they're going to be guidelines, and if you're following those, then you know, you generally speaking shouldn't have any issues.
Great. Another question that came up, and I was actually going to go to this when you were talking about it. If you have an incentive program in place, can you require proof of vaccine? And I think the answer, based on both of your guidance, is that you can require proof of vaccine. Just be cautious on the types of conversations that you're having so that you're not violating any HIPAA or private medical information as it pertains to that. Does that sound right? See, I'm learning.
Also, yeah, also just to jump in, that's the answer for now. But yep, again, there are some states with pending legislation that could preclude an employer from asking for proof of vaccination. So you'll want to be mindful of that.
Great. Another question that we just received, and this is popular transparently and vulnerably in the Empower HR crew here. How do I get my employees back into the office? We've made efforts to provide a safe environment for them, but yet they are still choosing to stay home. Can I mandate they come back in?
Great question. Do you want me to take this one?
Sure.
Jenny?
You can tag team it, because
yeah, we can take
probably has some follow up.
Okay, yeah. It's a great question, and it's one that I've gotten from many of my clients. And the answer, generally speaking, is yes. Look, we've been living a very strange year with many of our employees working outside the office who normally would be inside the office. People have gotten comfortable at home. They enjoy working at their kitchen table. They enjoy not having to commute to work, which is great. But most employers, they have a place of business. They have an office for a reason. If they wanted to be remote, they probably wouldn't have that place of business. So if you want your employees to be there, you can absolutely require them to be there. If your operations would be much more efficient and effective with your team in place, if your team morale would be higher, yes, you can bring people back. The one caveat I will say to that is if you have an employee who has some type of health condition or a disability that would preclude them from coming into work, then you might have to make an accommodation under that scenario. So I would encourage you to be flexible, but you can definitely otherwise require your employees to come back to the workplace.
Yeah, and Amy, I'll just build off of what you said. I do think that it's important, just even from a engagement perspective and just mental health and wellness, right? I mean, we're made to be in community, right? And it's important that we get people back to work, I believe, for that reason, right? We're hearing from our employees that they are lonely at home. They want to be back with people. And I think as long as we, make sure that they're coming back to a safe environment and we're following precautionary measures with the masks and the social distancing and things like that, there's no reason that we can't get people back to work. And I will say too, when employers make that decision to bring people back, I think the more advanced notice that we can give people too, so that they can make arrangements. A lot of people have their kids at home with them, so they're going to have to make arrangements for kids. So I think just to be considerate of that is important.
And just one other thing to add, you don't have to sort of flip the switch and make everybody come back in on a Monday. It can be a gradual progression back to the office. Put people on sort of A/B schedules, or have them come in 2 days a week and slowly ramp up to where you were pre-COVID. Sometimes that's easier for people to adjust under those circumstances.
I agree.
That's a great sort of pivot to this next question. Amy, I'll go to you on this one. What impact do vaccines have on in-person work environments? Do we have the right to know our employees' status regarding vaccination, which I think we've already determined the answer is yes, but any other further guidance as it pertains to how you're setting up workstations and so forth?
So it's a really interesting question, because a lot of people assume, once my workforce is vaccinated, we can sort of do away with the masks and do away with the face shields, do away with the plexiglass dividers, but we can't. You have to remember that there's always going to be a portion of your workforce, unless you have a mandatory vaccination plan, I suppose, that will not get the vaccine. So you sort of have to take precautions to protect the most vulnerable people in your workforce. And that includes following the CDC guidance and continuing to wear masks, continuing to social distance, and continuing to take other precautions, hand sanitizing, et cetera, to make sure that your workforce is safe. So I don't think, to answer your question, the vaccine is certainly going to help prevent us from getting the virus and from getting very sick from the virus. But I think for a while, at least, we're still going to be under the CDC guidelines.
Perfect. And then in line with that, there was another question: COVID prevention protocols after vaccination, what still needs to be in place? It's follow the CDC guidelines. I feel like we've said that now ad nauseum for over a year, but the fact is, the more you can continue to follow those guidelines, the better and safer you'll be. There was a question from the audience that said, is there a handout or PowerPoint slide that we should be following along for this presentation or following? A couple things there in the handout section. Just as a reminder, there's a blog about vaccines specifically, and there also will be sent a recording following this webinar today, the recording of this, along with some of the bullet points that both Amy and Jadro have walked us through. Amy, how do you deal with an employee who refuses to get a vaccine, but also claims they don't feel safe coming to the office? I think you had an example of this with a client in Florida recently, right?
Yeah. This is a tough one too. So I have a client in Florida who has an employee in the accounting department. So it's somebody who can perform her job remotely or from home. She she will not get the vaccine, but at the same time, she doesn't feel comfortable coming into work because she lives with her mother who's immunocompromised. And, you know, for a while, my client was willing to allow her to continue to work from home, but the accounting department at the company really collaborates together. And it's very challenging to do that remotely because things will come up in real time where, you know, someone will, you know, shout something, you know, to another person sitting near them, and they'll be able to resolve an issue very easily and quickly in the moment. So he ultimately required her to come back to work. She wasn't happy about it, but she came back. So, you know, I think it's a challenging situation to manage and to handle because it's sort of a lose-lose, because if you allow the employee to continue to remain outside your workforce, assuming you want them back, it's a lose for the employer. But if you require that the employee to come back to the office, the employee could view that as a lose for them. So it's sort of a fine line you have to walk. Again, you know, theme for this year is try to be flexible. But I recognize that sometimes you sort of do need to have a hard and fast rule for managing your employees, because otherwise, you know, certain people could take advantage of the situation, and then, you know, you let one person do it and all of a sudden you have nobody left in your office.
Amy, when we originally went back to work, gosh, late spring, summer last year, when employers were sort of bringing people back in and mandating that people come back in, obviously way prior to the vaccine, and people did not follow policy, did you see any terminations occur as a result of that? And if so, have you experienced any wrongful termination lawsuits as a result as well?
So to date, I have not had any wrongful termination lawsuits, but I do know that there are those types of suits, discrimination suits, brewing in the EEOC, perhaps with the DOL or OSHA. There are a number of different potential claims that could be filed, but because we are still living through this, none of those have come across my desk yet. And I think, you know, some of my clients have terminated employees, you know, over the last year in relation to COVID type issues. But I will say that COVID generally was not the only problem or the only issue at hand. There were other performance related issues that pre-existed the COVID issues, and COVID was sort of the icing on the cake. Of course, it could be, you know, risky to terminate an employee who took a leave of absence due to COVID. It could be viewed as retaliatory under the Ffcra or other laws. But, you know, sometimes you just have to make the difficult decision to move on, you know, from a business perspective. So stay tuned as to the lawsuits and administrative charges on that issue.
Yeah, we certainly, I think, saw an uptick in employers finding a reason as they were looking at furloughing employees and so forth, making hard decisions around performance-related terminations during that time as COVID sort of got into the height last year in the spring. Jennifer, another question from the audience, and I think this one, even before COVID, when looking at remote work policies, the question is for companies that are technology-based and are able to fully function in a remote environment for all staff, what types of things should be considered? I think both from a vaccination perspective and a return to work perspective.
Yeah, I mean, I do think that if you're going to move to a full remote workforce, that you definitely should have policies in place for that. That's another thing that we have done a lot of, because prior to COVID, a lot of our clients didn't have those policies in place. So making sure that you have a good policy, setting expectations for what that work from home looks like, and making sure that, you know, the big thing is when we have employees working from home, we want to make sure that they're just as productive there as they are when they're in the office. So having things in that policy to protect you know, those types of situations as well, I think is important. So I would strongly encourage that. And just also, if you are going to be moving to a remote work environment like that, there still has to be you know, intentionality around being able to connect with other people, right? So I don't know what that looks like. I mean, some people I know just have, you know, once a month meetings where they're actually coming together into the office in that case. But virtual is great, but it's, you know, it's definitely not the same, and you don't always get that same level of collaboration. Amy, I think you said you had a client where the team, you know, like to yell out like, hey, what do you think of this? Or, hey, I have this question. And, you know, you kind of lose that, you know, when everybody's remote.
Next question. This one I'll probably give to you, Amy, is how would you suggest handling individuals that have decided not to send their kids back to school or do not feel comfortable sending their kids to camp during the summer and thus do not have childcare for the summer?
That's a good one. That's a really good one. Yeah, Amy, what do you recommend for that? I'm going to take some notes on that one.
You really threw a hardball at me, Jenny. Well, so look, last year, this was a lot, well, I'm not going to say easier. This was different because we had the Ffcra, which, you know, could potentially provide you with partially paid leave if you had childcare issues due to COVID. It doesn't really sound to me like this is directly a COVID issue because it's not as if somebody has COVID. It's just that they're not necessarily comfortable sending their child to camp or to school because of COVID.
Right.
So there are a number of things you could do. Again, in the spirit of being flexible, if the employee is able to work from home with the child present, that's something you can offer. If the employee is able to change their hours, that's something else that could be considered. So for example, you know, if your business is not typically 9 to 5 or somebody doesn't need to be sitting at their desk doing something from 9 to 5, maybe the employee would be able to work early in the morning, maybe while the child is sleeping, or later at night, say after 8 p.m. when the child is sleeping, so that they're still getting their uninterrupted working hours, but not during the standard business day. You know, you can also, you know, consider allowing them to use paid time off, which depends on your PTO policy. And then if you have a discretionary leave of absence policy that would allow the employee to take a personal leave of absence, that can be offered as well. Although that, to me, really is an option or a choice of last resort. You want to try to work with your employee so they can continue to work, you know, especially in light of the fact if this person is a valued employee and you don't want to lose them. I would think you'd want to be a little bit more flexible and considerate and try to work through some options before you know, you have to lose them on a leave of absence or potentially terminate them and then have to bring in someone new and get that person ramped up, etc.
Yeah, of course, there's obviously a cost to turnover as well, anytime.
Yeah.
There was a question that was asked also, and I can probably take this one. What are the costs associated with getting a vaccine? Is this fully covered by insurance? And if someone may not have strong insurance, what is covered? I recently had a conversation with a great benefits partner of ours, Gordon Lightfoot. He said in most cases, people will pay nothing for the COVID-19 vaccine. Laws and regulations were implemented soon after the pandemic began to ensure that most people would be able to access the vaccine at no cost. So hopefully there either is insurance in play or it will be no cost dependent on what provider you are seeking to receive the vaccine from. I have one more question here, Amy. How should we handle customers that can show proof of vaccine? I am in personal services, so this goes a little bit outside the scope of employees. It's now, how do you handle your customers and requiring proof of vaccine? So if you're in the dental business or the medical field or personal services, getting hair, wax, nails, whatever. How do employers handle that to keep their employees safe?
Sure. Yeah, so even if you're requiring customers to provide proof of vaccination and they provide that proof, you should still follow the CDC guidelines and require those customers to wear a face mask, to social distance to the extent possible. I think the question came in related to facial services or something where the employee would be in close proximity and they wouldn't be able to social distance from the customer. And that's fine as long as the other restrictions are in place. The employee is masked, the customer is masked to the extent possible when they're not getting the service. And then of course, hand sanitizer, and there might be the ability to put up a plexiglass shield or implement, and of course, implement cleaning and sterilization as well. So I don't think just because a customer is vaccinated, you can do away with the other CDC guidance.
And as it pertains to PPE, that makes sense. Earlier on, we talked about exposure and quarantining following the vaccine. The question that came in was, are you saying that a vaccine only lasts 3 months as to COVID exposure and quarantining? There was some clarification asked there in that question.
Yeah, I'm happy to take that. I think, Jennifer, you talked about that. So the CDC guidance is kind of interesting on this point. So I don't think anybody really knows at this point, even the medical professionals, how long the vaccine will remain effective. But what the CDC is saying is that somebody who's been vaccinated is not required to quarantine if they've come in contact with somebody who has tested positive for COVID or who is exhibiting symptoms of COVID. If number one, they've been fully vaccinated and it's been at least 2 weeks since they received the last dose, their exposure to that person occurred no more than 3 months from receipt of the last dose, and they remain asymptomatic. So I'm not sure why the CDC includes that second requirement, that the exposure have occurred not more than 3 months after getting the vaccine. I'm sure there's some medical evidence to support that, but that's just what the guidance is.
Yeah, and Amy, just to kind of build off of that too, you know, something that, you know, I've read recently is just that there's a lot of unknowns in terms of how long it remains effective. So I'm not sure if that's why they use that length of time in that guidance, but you know, I know that we'll definitely learn more, you know, as time goes on here and more research is done on the vaccination.
Yeah, absolutely. Last question while we wrap here. When providing incentives to employees to get vaccinated, how do you accommodate those not able to take the vaccine for personal reasons? So I think both of you alluded to potentially medical reasons or religious reasons. How do you provide that accommodation?
Jen, are you, I guess, is it like, how do you document that?
Yes.
Or how do you?
I will assume that that's what this participant is asking.
Yeah, so I mean, Amy, we can tag team this, but I know that there is, and I believe we have included it, or we plan to include it in or sending it out after the webinar. There is a document that can be used to document the religious reason for an accommodation. And then if it's a disability related reason, just the ADA, the standard ADA paperwork could be used in that case.
And just to jump on that, as far as alternatives that can be provided, so your incentive program is fair for those who either cannot obtain the vaccine or who simply won't obtain the vaccine, you can incentivize them in different ways. So You could provide the same incentive, but instead of requiring them to get the vaccine, you can perhaps require them to attend COVID training. You can perhaps require them to work from home so that you're not exposing your vaccinated employees to non-vaccinated employees. You could also consider requiring them to get regular COVID testing or to wear an N95 mask instead of just your standard mask that you could buy anywhere. So there are things that you can do to improve the safety and security of your workplace, even if there are people who won't get the vaccine.
Great. Any other closing comments from the two of you? This has been a tremendous amount of information. I'm sure our audience is appreciative of not having to scour documents and handouts and CDC website and so forth. Is there anything else that you want to add in before we wrap today?
You know, Jen, just one thing for me is, and we discussed this a little bit earlier, but just continuing on with the importance, I think, with being flexible with employees to help them feel safe and supported during this time, and just really emphasizing the importance of good communication and being really transparent, and just also remembering to factor in that human element as we're having these discussions, as some of these decisions are being made.
Those are great points. And I think from a legal perspective, I would encourage everybody to do your best to stay up to date on COVID-related employment laws and guidance because they are changing on a daily basis. So don't assume that what was the guidance yesterday or what was the law yesterday is the law today. Because your decisions based on those laws and guidance could impact your workforce.
Absolutely.
Yeah, so lean on, we have contact information for both Jadro and Amy. Feel free to lean on your Empower HR team. If you're not a current client, we'd love to still have conversations with you and provide some advice as you see fit. And Amy would love to serve as a resource as well. Jadro, also from the audience, rubbing alcohol may take the Sharpie off the whiteboard. So you have that. Maybe we'll provide an update when we send the recording and the handouts out. And I'll close with, as Jadro alluded to, and Amy as well, there is a human element to this. I think a lot of it is, you see the Googles and the Teslas and the large organizations of the world doing a lot of different things, but the fact is that the target market that we serve and that we are is a small to middle market business, right? And so that has different challenges in itself. So when possible, what we do is always, we are delivering on our purpose, understanding what matters to our employees, having that authentic connection with them, and then being relentlessly accountable to those outcomes. So that is absolutely the best way to go, is leading with heart and accountability as you're working with your employees through these ever evolving and uncharted waters. And last but certainly not least, we had one last comment, Jadro. I like your drawing. Leave it up there for a while. So thank you all this morning. Have a great rest of your week, everyone. We look forward to continuing to stay in touch with you as these things continue to evolve, and we'll talk to you soon. Thanks all.
Bye, everybody.
Thanks, everyone. Bye.
Bye.